Welcome back, my dear students. Today we are going to learn about myocardial infarction or MI, which is commonly called heart attack. This happens when a coronary artery suddenly gets blocked, cutting off blood and oxygen to a part of the heart muscle. Without oxygen, that portion of the heart starts to die, which is called as necrosis or cell death of the heart. The main reason is usually a ruptured atherosclerotic plaque that triggers a clot formation, completely stopping blood flow. Within 20 to 40 minutes, the damage becomes permanent. That's why MI or myocardial infarction is a medical emergency. In this class, we will explore how and why a heart attack develops, the typical warning signs, what doctors do immediately to save the heart, and how lifestyle plus medicines can prevent in the long term or in the long run. Let's understand these life-saving topics step by step so that you can clearly connect the biological science, the biology with real life awareness. What is myocardial infarction or what is heart attack? Myocardial infarction or MI means death or necrosis of heart muscle because the blood supply to that part of the heart is blocked for a long time. Simply, when the heart muscle doesn't get oxygen due to blocked artery, that part dies and it causes heart attack. Risk factors. Who is more likely to get it? Non-modifiable, which we cannot change. Age, our risk increases as we grow older. Male sex, men are at higher risk. Women catch up after menopause. Family history, if parents or siblings had heart disease. Genetic predisposition, if bad genes are present. Modifiable, we can control. Smoking, high blood pressure or hypertension, diabetes, high cholesterol, that is high LDL, low HDL and fatty diet, obesity and lack of exercise, stress plus junk food such as more fat and less fiber, alcohol abuse. Remember, the more junk we food the heart, the more likely it is to protest. How does MI happen? What is the pathophysiology in steps? Plaque builds up inside the coronary arteries, atherosclerosis or fatty blockage occurs. Then the plaque cracks or ruptures inside, fatty core comes out, platelets thick, clot forms. Then the artery gets blocked and blood flow stops. Ischemia is the heart muscle doesn't get oxygen. So heart cells die, which is called as necrosis. After 20 to 40 minutes of complete blockage, death is irreversible. So death starts from inner layer on endocardium to outer layer or epicardium. Heart muscles then cannot contract properly, less pumping and cardiac output goes downward. What can be the complications? Irregular heartbeat or arrhythmia, heart failure, cardiogenic shock, heart rupture, sudden death, etc. The myocardial infarction or MI or heart attack, the death of occurs due to the death of cardiac muscle, and most common cause is atherosclerosis in the coronary arteries. Management. How do doctors treat it? First, we have to know that what are the heart attack signs like chest pain, vomiting, sweating, dizziness, etc. So, what are the emergency or immediate or first aid in hospital for the management of myocardial infrastructure, myocardial infarction? Remember MONA B, M for morphine for pain and anxiety, O for oxygen. If oxygen is low, SpO2 is less than 90%, then heart attack can occur. Nitrate, N for nitrate to open blood vessels and reduce chest pain. A for aspirin, chew it and prevents more clotting. B, beta blocker, reduce heart's workload. Next step, reperfusion or reopen the artery. Clot busting drugs like thrombolysis, streptokinase, altiplase, tenecteplase, etc. Primary PCI, what is angioplasty or plus stent, best if done within 90 minutes. and CABG or bypass surgery if many blockages are present. Long-term care or secondary preventions, medicines like aspirin or antiplatelet, which is lifelong, beta blockers, ACE inhibitors or ARBs, statins to reduce cholesterol, dual antiplatelet therapy, that is aspirin plus clopidogrel. Lifestyle, the real game changer, quit smoking and alcohol, healthy food like low salt, low fat, more fruits and vegetables, exercise regularly, cardiac rehab is best, maintain healthy diet, healthy weight and manage the stress. This is the tiny balloon. It is done by placing and inflating a tiny balloon at the location of the clogged or blocked artery to help widen it. In today's class, we learned that a myocardial infarction happens when a coronary artery is suddenly blocked, cutting off oxygen supply and causing death of heart muscle. That's why we commonly call a heart attack. The main reason is atherosclerosis with clot formation, and it is made worse by risk factors like smoking, high blood pressure, diabetes, obesity and stress. But the good news is with early emergency care like Mona B and reperfusion therapy and long-term preventions like medicines and lifestyle changes, many heart attacks can be treated and even prevented. So remember, act first, live smart and protect your heart. Stay healthy, stay strong and keep learning. See you in the next class. Thank you.